So apparently it's a lot of border movement taking place, even though the federal government has said that interstate travel is still, a ban is still in progress. We have Dr. Adewale Agosu. He's a public health physician. He joins us here in Lagos. Is interstate travel, is the ban really working? And I mean, the federal government put it in place to curb the spread of COVID-19, yet we're having Nigerians move, and not just in the boundary that he mentioned, across the country.
Thank you, Millicent, for having me. I think the enforcement is not enough. We know our people like to be enforced into doing the right thing. If you have given an order, you have given a directive that there shouldn't be interstate movement, then there shouldn't be interstate movement. The law enforcement agents should enforce the law and be strict about it. I know Ogun State is trying as regards that, but other states should take clue.
But seeing as we're also seeing a rise in infections, daily infections in the country, do you think it would be wise that we go back to a total shutdown so that we can reduce the rate of infection?
I don't think that is sustainable. Total shutdown, as of now, is not sustainable, because even the last complete shutdown we still had increase in a number of cases. So I don't think there should be a total shutdown. Rather, people should follow the instructions, follow the directives. If you don't have any business to go out, just stay at home. Then I think the awareness is not enough. Awareness is not enough. The approach and the response should be a bottom to the top approach. Since we have a community spread already, let's bring it out to the community. Each local government has, we have some 774 local governments. In this local government, you have wards, we have councillors, we have chairman. Even in the ward, you have the ward, the CDC, the Community Development Committee, and in the ward, you have the ward health. I'm taking Lagos State as a case study. You have ward health committee. These people have means of communicating with us, taking responsibility from the community. I think it will go a long way.
I want to quickly get your thought on asymptomatic cases. The WHO said that most transmission is occurring from symptomatic to others, and there isn't enough evidence to show how much or what the rate is from asymptomatic to others for COVID-19. Well, we're seeing a rate of community transmission. So what exactly are we seeing in Nigeria?
Okay. The WHO official actually said the rate of the frequency of asymptomatic patients infecting others is what they are still looking. They don't know much about. They're still studying. Well, since this virus is a new one, a lot of things, a lot of knowledge is still being discovered about this virus. However, if someone, my opinion, if someone is asymptomatic, it doesn't mean the person doesn't have the virus. You have the virus, you carry the virus until you become pre-symptomatic and symptomatic before you now spread shed this virus to people. And people being infected, the ones that are at most risk, the elderly, the ones that have underlying diseases, hypertension, diabetes, etc. So it's important. It's important we don't we follow the rules, and if we don't have anything to do outside, just stay indoors. Yes.
Continue with these safety protocols. We'd like to thank you, Dr. Adewale Agosu, a public health physician. Thank you for joining us.
Thank you.